Recording in progress.
Okay, good morning. Let's start the meeting. It's really an honor to be here. We have some very distinguished participants. Some of them are together with us in this webinar. Others sent a pre-recorded video that will be presented. So I want to thank and to recognize Jorge Allen, that is our Director Emeritus of PAHO. We also have here Dr. Jimena Aguilera, Minister of Health of Chile. We will have a video from Minister Nívia Trindade from Brazil. We also have here Dr. Peter Figueroa, Professor of Public Health Epidemiology and HIV/AIDS from the University of West Indies, Jamaica. We have many other guests that will participate. And here with us also, we have our Deputy Director, Marilu Valdez, our Assistant Director, Bronda Cili Thomas, and the Director of the Health Emergency, Public Health Emergency Department, Dr. Ciro Ugarte. Distinguished colleagues and friends, it is an honor to be with you today to celebrate the centenary of the Pan American Sanitary Code, a milestone in the history of public health in our region and in the world. Since its adoption in 1924, this code has laid the foundation for health cooperation in the Americas with a collaborative vision that is more relevant today than ever. Its creation marked a period when countries in the region joined efforts to protect the health of their populations, recognizing the importance of a regional coordinated action against health threats. The code, approved at the 7th session of the Pan American Sanitary Conference in Havana, and later ratified by all the countries of the Americas, was the result of an innovative agreement that responded to health challenges of those days and clearly demonstrates the spirit of Pan Americanism. This spirit continues to unite us in protecting and improving the health and well-being of the population of our continent. Today, a century later, 20 articles of the Pan American Sanitary Code remain in force, establishing the fundamental duties of the organization as a regional public health agency. These include, among others, monitoring health in the Americas, supporting countries in disease control, facilitating health cooperation, and collecting and reporting health data on morbidity and mortality statistics. The code also established the financial commitment of member states to ensure the necessary resources for PAHO to fulfill its mandate and continue promoting our technical work with the countries in the region. The Pan American Sanitary Code adopted a regional approach that established a model of cross-border collaboration, inspiring the creation of other health cooperation frameworks globally. Thus, in 1951, the World Health Assembly, recognizing the importance and relevance, among others, of the Pan American Sanitary Code, adopted the first international health regulations, IHR, mentioning 43 articles of our code in the new regulations on surveillance, control, and port health that came into force globally. Let me now switch to Spanish. La pandemia de COVID-19 evidenciou a necessidade de América Latina y el Caribe en producir.
The pandemic 2019 showed that in Latin America, we had to have critical products to face these health challenges. These challenges show us that 100 years later, the principles of Pan-Americanism and solidarity have been established in the Pan American Health Code are still in effect and necessary. So throughout the World Health Assembly that happened in May of this year, the countries adopted an important number of amendments to the International Health Regulation of 2005 that will allow a preparation and a more effective response. Presently, the member states of the WHO are negotiating a new agreement about pandemics to prepare the world better to face health emergencies and other future outbreaks. So in this process, the PAHO Secretariat has prioritized its support to the state members, summoning in-person meetings with the employees of the health ministries and foreign affairs of their capitals, of our capitals, and the permanent missions in Geneva and Washington to discuss the priority elements of these negotiations for the countries and their implications for the Americas. Our countries have achieved important consensus, and we have agreed upon more than 16 joint statements about these clear topics related to the pandemics and also regulations for the International Health Code. This is something that hadn't been possible in the last 7 years. So PAHO has been working in health projects and capacities in the Caribbean and North America and South America to strengthen the detection systems, the alert systems, and the response systems, including the capacity of the national labs to establish and broaden the genomic surveillance network in the region. So the same spirit of cooperation that inspired the Code of 1924 is reflected in the implementation of the Regional Innovation Production Platform for medications. This is a Pan-American effort, is collaborative to reach self-sufficiency in health technologies and to promote the regional production of medication, vaccines, and critical health products. So today, the Pan American Health Code complements the global efforts to reduce risks and to respond to emergencies, to sanitary emergencies. And we create together robust systems that allows us to face the threats related to our health in a world that is more and more interconnected. So in this memorable day, we have taken on this commitment of the Pan American Health Organization with our ideals of solidarity and cooperation that have inspired the creation of this code a century ago. We must acknowledge that our safety and well-being depends on a unified collaboration in public health in the whole continent. And as we continue to strengthen the implementation of these two essential frameworks, we must reaffirm our vision of building health systems that are truly resilient at the national, regional, and global levels. These 100 years of Pan Americanism should inspire us to continue to strengthen our collaboration and solidarity so we can continue to build together a future with more health and well-being for the Pan American peoples. Thank you very much.
Muchísimas gracias, Dr. Barbosa.
Thank you very much, Dr. Barbosa. So after this great opening statement that fills us with satisfaction about all the work that we are doing in the Americas region and what we have ahead of us, I have the great pleasure of now inviting Dr. Sir George Alain, the Director Emeritus of PAHO, that will share with us his words about the genesis and the evolution of the Pan American Sanitary Code. Dr. Alain, you have the floor.
Thank you very much, Dr. Ugarte, Dr. Barbosa, ladies and gentlemen. It is a pleasure to be here, and I must thank Dr. Barbosa for the invitation to join you on this memorable occasion of the celebration of 100 years of the Code. This is double for me, a double pleasure for me, because I had the privilege of participating in the celebration of the 75th anniversary of the Code in Havana, Cuba. In fact, the original document resides in the Ministry of Foreign Affairs in Havana. And my research then, if I needed any convincing, convinced me of the importance of the Code as one of the more important international health documents of the world. And let me build a bit of what Dr. Barbosa has said of Pan Americanism, because it convinced me then even more of the value of Pan Americanism as an organizing principle for the work on improving the health of the region. Perhaps the idea of Pan Americanism goes back to Simon Bolivar, and I'm not going to go that far. But on the turn of the last century, this idea really flourished. So we find the Secretary of State of the United States, Mr. L.U. Root, who gained the Nobel Peace Prize. In the third Inter-American Conference in Rio, he argued passionately for the virtue of Pan-Americanism. He argued passionately for the countries of the Americas to work together. And this had more effect because just after the war, trade, intra-regional trade exploded exponentially. There was more trade among the countries of the Americas just after the war than there ever was before. So the conjunction of increased trade and the enthusiasm for Pan-Americanism led eventually to inevitably to the signing of the Pan American Sanitary Code. And of course, it led to the establishment or the designation of the Pan American Sanitary Bureau as one of the pillars of making this code effective. In fact, so effective was this code that when the Pan American Health Organization had its constitution written in 1947, it is a direct result of Article 54 of the Pan American Sanitary Code. The idea of Pan-Americanism and the integrity of the Pan-American ideal will be questioned from time to time. And we've seen, for example, in 1948, when the World Health Organization was founded, there was an idea that PAHO should be absorbed into WHO and the Pan American Sanitary Bureau abolished. But the countries of the Americas, faithful to their doctrine of Pan-Americanism and faithful to the idea and ideal of working together for the benefit of the health of the Americas, resisted that. And I'm sure in the course of time, if there's other fissures in international relations, we may see some subsequent threats. But I have no doubt of the capacity of the countries of the Americas to resist those threats and continue to focus on Pan-Americanism and the relevance of their organization. At the conclusion of the signing of the celebration of the 75th anniversary of the code, the Minister of Health of Cuba spoke eloquently and passionately about the importance of the code. Allow me to read what he said at that time. And he said, one of the more fundamental manifestations of Pan-Americanism is in sanitary cooperation, and that will be one of the principal columns on which rests the harmony, progress, and peace of America. And to all that we should say amen. So my thesis is that the code is a living manifestation of the relevance of the Pan-American doctrine, and I trust that its expression in health continues to find expression in the Pan American Health Organization from generation to generation. Thank you.
Thank you, Dr. Alain. You brought us some of the key aspects of the code, but also you highlighted the Pan-Americanism and the linkages between trade and well-being and health of the Americas. Very good. We will have now the video from Dr. Mirta Roses, directora emérita de la OPS, que nos ha enviado un mensaje.
The Director Emeritus of PAHO that also has sent us a message. Go ahead, Dr. Roses. So greetings from Buenos Aires, Argentina, with a special thanks for this invitation. It's a pleasure to be with you in this historic day, the celebration of the Pan American Sanitary Code. At the end of the 19th century, the independent countries of the American continent, they consolidated their republican institutionality. And we were providing food to Europe with grains, proteins, and other goods. And they were receiving a wave of migrants from Europe and Asia after many efforts and attempts to create a path for trade between the Atlantic and Pacific Oceans. They started a project of the Panama Canal. But the several diseases such as yellow fever, malaria, cholera, they would obstruct international trade and also the construction of the canal. In the end of 1989 in Washington, we had the first International American Conference. And it was created a commission with members of 5 countries, Brazil, US, Nicaragua, Peru, and Venezuela, to exchange knowledge about the new prevention methods, prevention of diseases, and to promote sanitary regulations to promote trade between countries. The second conference in 92 requested the International Office of the American Republics, that today is the Organization of the American States, to summon delegates of the health offices to put together a sanitary office to promote agreements that could come together frequently to update their vision. So Dr. Carlos Finlay, a great academic of the yellow fever, was one of the members of this committee and proposed the creation of the new International Sanitary Office that today is the Pan American Health Organization. In parallel, in Paris, we had the 11th International Sanitary Conference. And this, in 1951, they had summoned the country which had maritime interest in the Mediterranean to reduce disorganization and the regulation of the ports facing epidemics. So they tried to unite the 4 sanitary agreements and to build a single instrument, the International Sanitary Agreement, with provisions that would be applied to cholera, the pest, and yellow fever. So the general surgeon of the US, William Gordas, he informed about the actions of this 4th commission to study the yellow fever, confirming the finalized study about the role of the Aedes mosquito. The second International Convention, Health Convention in Washington, 95, defined the role of the office and the recompilation and standardization of the measures applied in the control of yellow fever in Cuba, in the region of the Panama Canal and Mexico. And in 1995, on the 14th of October, was signed the first Pan American Sanitary Code. The third International Sanitary Convention, Mexico, in 97, established a coordination with the the first agency with that was based in Paris, and it recommended the 1905 Washington Code so that the colonies of France, Great Britain, and other countries could observe the resolutions of the American republics. So the International Health Office did not have a scientific instrument that would be that could be used to be adopted by the countries. So we had a standardization about prophylaxis and also the dissemination of international diseases. So the promotion of these health practices in the ports was crucial for economic development of the Americas. In the 5th Sanitary Conference in Chile in 1911, they changed the name from Pan American Health Office to the Sanitary Pan American Office. So in 10 years, this was already a a landmark for the Americas. And then the 6th conference that was held in Uruguay, that was postponed from 1915 to 1920 after the First World War, decided to establish an international bulletin of the American republics. So it was, and then it was the bulletin of the Pan American Health Office, and promoted better development of these activities. And finally, the 7th Pan American Conference in Cuba approved the Pan American Sanitary Code with 18 countries present in the auditorium. In the old academic auditorium for natural and medical sciences, and this was in 1924. This is ratified by the parliaments of the American republics, and this is in effect till today. The code represents the highest achievement of the standardization of health practices in the American continent and the culmination of decades of initiatives, of international initiatives. The code has defined the terms proposed to eliminate the dissemination of international diseases and also proposed cooperation to stop the propagation of diseases, also proposed to collect statistical data and to stimulate an exchange of reports to improve public health and to fight diseases. So this office was established as the central office of the republics in the Pan American Union, and this is a hub for health reports, statistics, morbidity, and also new methods to fight these diseases. The code was ratified by the parliaments of the member states, and the 8th Pan American Sanitary Conference that was held in Peru in 1927 approved an additional protocol promoting that the ratifications and amendments should be deposited in the Secretariat of the State of Cuba. In 1923, the International Sanitary Office started to be called the Pan American International Office. And after 58, the name was Pan American Health Organization. Very well. We heard Dr. Rose's important also data about the genesis of evolution of the Pan American Sanitary Code. Dr. Jarvis Barbosa, you have the floor. Thank you very much. Just to finish that first part and to thank both of our Director Emeritus, our dear Director Emeritus, Dr. Mirta Roses, and our dear Director Emeritus, Sir George Alain. And I think they really have encompassed this historic concept, but also the perspectives that we had at the time and how this was so important for the configuration of our Pan American Health Organization as we know it today. So with that, we close this first part. I would like to thank both emeritus directors, or Director Emeritus, and now we will go on to the second part and with the video and then the panel. Thank you very much. Thank you very much, Dr. Barbosa. Effectively, we have a short video that reflects also the historic part of the Pan American Sanitary Code. Please, if you can show it.
On November 14th, 1924, in Havana, Cuba, history was made for public health in the Americas. The Pan American Sanitary Code was signed ad referendum by representatives from 18 nations at the Assembly Hall of the Academy of Medical, Physical, and Natural Sciences, now known as the Carlos J. Finlay Historical Museum of Science. This code, later ratified by all countries in the Americas, defined the duties of the Pan American Sanitary Bureau, today known as the Pan American Health Organization, PAHO. It established clear responsibilities for countries to report disease outbreaks, standardize prevention and control efforts, and gather crucial health data. This collaborative approach, rooted in the values of Pan Americanism, recognized that health cooperation was essential, not only for the well-being of each country, but for fostering safe international trade across borders. Even today, a century later, the Pan American Sanitary Code remains a guiding force, continuing to shape PAHO's mission to promote the health and well-being of individuals, families, and communities across the Americas. This code stands as one of the most remarkable achievements in health policy, uniting nations under a shared commitment to public health excellence. In 2024, a century after the signing of the code, we honor the legacy of its architects, as PAHO and its member states persist in their efforts to improve the health and well-being of all people in the Americas.
Qué bonito video, nos da ganas de aplaudir por ese video, está muy bonito con la participación, por supuesto.
Beautiful video, round of applause. It's so amazing to have the participation of all the health practitioners and all those that work to implement the Pan American Sanitary Code. So now let's go on to the panel. So in this panel about the century of the Pan American Sanitary Code in the Americas region, we will have the participation of the Dr. Jimena Aguilera, which is the Ministry of Health of Chile, that will present to us the systems of health within the context of the Pan American Sanitary Code. So, dear Minister, you have the floor. Go ahead. Thank you very much. Well, first, I would like to thank you for the invitation to participate in this important seminar that that has been dedicated to the celebration of this important instrument for all of us in the Americas. I'm going to share a presentation. So can you see it?
La vemos, pero no en modo presentación,
We can
ministro.
see it, but it's not in presentation mode, Minister.
Muy bien, ahí se ve bien.
All right, can you see it now?
Bueno, y
Yes,
consideramos
perfect.
que los 100 años del
All right, so we
Código
consider that the 100
Sanitario
years
es una
of the
importante
Pan American
referencia
Sanitary Code,
internacional en la
it's
salud
a
pública.
crucial landmark
Primero,
for
decir
our
que
international
venimos de
agreements to
hablar acerca
promote
de los
public
sistemas de
health.
salud en el
First, I would like to
contexto
say
del Código
that they asked
Sanitario
me
y
to
quisiera
talk about the
manifestar
health
que
systems
en
in the
esta
context of
perspectiva,
the Sanitary
el
Code, and I
Código
would like to say
Sanitario
that in my
Panamericano
perspective, Pan
representa un hito en
American
el
Sanitary Code
reconocimiento de los
represents a
países
landmark in the
americanos sobre la
acknowledgement of the
responsabilidad del
American countries
Estado
about the
en gestión
responsibility of the
sanitaria.
state in
Y desde este
sanitary
punto de
issues.
vista, en el
And
impulso
from
y la
this point of
promoción de los
view,
sistemas
in
públicos de salud,
the
en la
promotion of these public
contextualización
health
de las
system and the
funciones esenciales de la
contextualization
salud
of the
pública.
essential
El
functions or
primer
roles of
parámetro
public health.
menciona que el Código
So in this
Sanitario
slide, we can
Panamericano,
see that the
firmado
Pan
en La
American
Habana
Sanitary
durante
Code that
este
was signed
histórico,
in
que tuvo
La
grandes
Habana
impactos
was a historic
significativos en el
agreement
desarrollo de
that
los
had
sistemas de salud.
important impacts in the development of health
El
systems.
efecto del código en el desarrollo de
So
los
the effect
sistemas
of
quiero
the
tratar de
code and
resumir y
development of
voy a tratar
systems
de
can be
resumir en
described, and I'm going to
5
try to
puntos.
describe
Primero,
this,
en su
summarize this in
rol como
5 points.
fundamento de la
Firstly,
cooperación
we have the role
internacional
for
y el
the
efecto que tuvo en
foundation
la
for
infraestructura de
international
los sistemas
sanitary
de salud,
cooperation. Then
en
we
el
have the
desarrollo de normas,
infrastructure
en el
in the
desarrollo
health systems
institucional
and
de la salud
development of
pública y el
standards
legado que
and
tiene
institutional
el Código
development
Sanitario.
of public health and the legacy that
Como
has
fundamento de
in
la
terms of the
cooperación
sanitary code.
sanitaria
So as a foundation
internacional,
for international sanitary cooperation,
el rol principal que tuvo
the
fue
main role
establecer
that it
procedimientos
had was to
estandarizados
establish
y
the standardized
arbitraje para la
procedures,
prevención y
create
control
a
de
framework for the
enfermedades y
prevention and
mecanismos
the
para la
control
respuesta a
of
emergencias
diseases and
sanitarias.
mechanisms to
Yo como
respond to
epidemióloga no puedo dejar de
sanitary
mencionar, como
emergencies.
mencionó la directora clínica
Myself,
Dr. Rosa, que me dio
as
mucho gusto
a
tener la oportunidad de
biologist,
verla,
it was
básicamente el
great
código
to
fue
hear what my
elaborado
colleague
luego
said. I
del
would like to
proceso
say
europeo en
that
el siglo XIX,
this
buscado
code
por la
was
necesidad
a
de nuevas
combination of
respuestas sanitarias
several issues
dados
that we saw in the
a
19th
la
century. This
civilización
was
moderna, dadas
promoted by the
cuestiones
health
como
needs
epidemias
since
infecciosas,
progress
desnutrición,
in
alcohol
modern
y suicidio.
civilization
En el
brought
siglo
many
XIX es
issues
cuando se
such
observan
as
las primeras
malnutrition,
epidemias, las primeras
and
pandemias
and so
cólera
in the
desde
19th century we see the
1827
first
y
cholera
se propagan
pandemics,
desde su cuna endémica,
and these
llegando
are
ya
they
desde la segunda mitad del
propagate,
siglo
and
XIX a los
then this
Estados
goes all the
Unidos,
way
México
to
y
the
Canadá.
second half of
Hacia
19th
finales del
century.
siglo
It
XIX se
reaches
producen los
US,
censos,
Mexico, and Canada.
menciona
Then at the end of the
la
19th
necesidad
century,
del asunto
we
sanitario,
see
que es el avance en el
basically the
conocimiento de las causas de las
awakening,
enfermedades que
right, of the
transfieren
causes of
de
these
la enfermedad
diseases,
como un
and
trazador de la
also the idea
exclusión y
of a
la
disease
vulnerabilidad
as
social,
something
elementos
that
que
promotes
siguen en la
poverty
discusión
and
de
also that
siglos.
promotes social issues, and
Se
something
mostró
that
una
we continue to
situación
discuss this
determinada por
century. So
la,
all of
como
this
mencionaba
phenomenon was
anteriormente, la revolución
determined,
industrial,
as we saw before, we
demográfica y
had the
migración,
Industrial Revolution
mencionada por la
and
doctora
the
Rosa, la
demographic
obesidad
explosion and
y la falta de
migration,
sanidad en la
as was
población.
mentioned by Dr. Roses as
Consecuentemente,
well.
también
And
cambiaron conceptos
consequently,
sobre la
this
responsabilidad
changed concepts
pública,
about
sobre los
the
asuntos
public
de la salud,
responsibility
el
about
rol del
health
Estado o de
matters,
los
the role of
estados
the
en la salud
state
de la
or the
población,
states in the
de ser una
health of
cuestión
the
puramente
population,
individual.
which is no
La
longer
salud
something
pública pasó a
individual.
ser una
Public
meta
health
social y social,
becomes a
necesidad
social
de la
goal,
acción colectiva
and
en el
therefore we
campo
see the need to have
internacional.
collective action
En las
in the
Américas, a fines del
international
siglo XIX, los
environment.
Estados Unidos
At the end of the
tuvieron la
19th
recepción
century in the
inmediata
Americas, the US
ante
was
la
the
necesidad de
first
tomar medidas
country that
en el
was
periodo de
receiving
epidemia y de la
migrants, and they
certificación de
had to take
médicos.
measures, and they established medical
En este
certification, for
contexto, la
instance,
gran
and
epidemia de
outbreak
fecha
control.
amarilla, que también ya fue
So in this
mencionada, que afectó
context,
a
we
los
have the yellow
principales
fever, as
puertos
was mentioned
americanos,
already,
estimuló
that
a
affected
que en la
the
segunda
main
conferencia de
ports
los
in the
estados
US.
americanos
And this
en La Haya se
fostered
dictaron la
this
resolución por la
second
creación del
conference
organismo
of the
especializado en
American
la salud,
states.
que fue
And
la Asamblea
then they
Sanitaria Internacional en
established this International
1902 y que hoy día es
Sanitary
la
Office
Organización Panamericana
in
de Salud.
1910, which
Es por
today
lo tanto la
is PAHO.
necesidad de enfrentar
So
las
therefore,
situaciones
this is the
sanitarias
need to
producidas por
face
la
these
epidemia y
sanitary
pandemias,
challenges that
requiere el
have been
fundamento de la cooperación
produced by
internacional
these
y la
outbreaks and
consejería es aún más
pandemics, which
urgente.
is the foundation of this international
Cuando
cooperation.
menciono
This is
el
something
segundo
that is
efecto
still
del
in effect
código en la
today.
estructura del
When I
sistema de
mentioned the
salud, se pueden
second
mencionar tres
effect of the
puntos
code
principales que aparecen en
in
esta
our health
diapositiva.
systems, we see
Alertó a los países a
here the
desarrollar
important important points that we see in this slide. It encouraged the countries to develop public national institutions for public health, promoted the creation of health authorities, and established requirements for any sanitary facilities, and quarantine in ports. So I would like to mention both PAHO and the Sanitary Code. So in this first context, we have PAHO, where we see here a delegate of my country, Dr. Eduardo Moore. So when we read the biography of this doctor, we see that he was a urologist surgeon and he specialized in Europe. And we can see that he founded the nursery school in Chile and participated in the organization of medical services of the armed forces. So he was a stakeholder that participated in the creation of our health system and helped to materialize the responsibility of the state to have public health services. And probably this motivation of creating health institutions and to start creating this health system was also present in other stakeholders at that time. So in this slide that we see now, we have the picture of the delegates that were part of the seventh International American Conference, which is where they finally signed the Pan American Sanitary Code. They approved this new sanitary code, a document that was signed, as was mentioned, by 18 representatives. And I would like to highlight this once again that we have a delegate from my country, and here he talks about this desire to advance, to perfect our sanitary institutions. So therefore, the creation of the code is linked to the initial development of these health systems. So therefore, with the creation of the code, this fostered new standards. So in this slide, we see three basic points, but the effect goes beyond and establishes the standardization of practices that have been enabled to progress into standardized procedures in our region and many other environments of public health, not only for the control of, communicable diseases, but also to establish minimal standards, create uniform procedures, and establish minimum guidelines, which is also the role of PAHO. So as far as institutional development, this code was international. It strengthened also PAHO and also helped to create national offices in the member states, but it also helped to promote the development of public health labs. In some of our countries, like my own, were one of the first ones that created these labs that were funded by the state. So regarding the legacy of the Pan American Sanitary Code, I'd like to mention four. It influenced the structure of our modern health systems. It provided a model for regional sanitary cooperation. It contributed to the standardization of health practices in the Americas. And it's something that we still see today, thanks to the reformulation of the essential roles of public health. So the code helped to conceptualize our public health as we see it today. So if we click on these essential roles of public health, we see some of these principles that are shared, such as focus based on populational health. We have responsibility of the government in terms of public health, also standardized practices needs, and also importance of the sanitary information systems and regional cooperation. So we can see that in the institutional framework, we created structures that would abolish other institutions. So we also created structures, established the importance of government responsibility, and also it established precedents for the regional coordination of health matters. And also, we see that this effort that started in the 90s has established the principles of the code, and this new formulation remains. We still emphasize standardization and the minimum level of skills that are necessary for this comprehensive health services in our international environment. So finally, to summarize, we can see that the code has established crucial responsibilities for our public health for the different governments. These first definitions help to for us understand how we see public health services, and definitely the Pan American Sanitary Code had significant impact in the development of health systems and helped to conceptualize the responsibilities of the states in terms of public health. Thank you very much. Thank you very much, Your Honor, Dr. Jimena Aguilera. So it's It was great to see this whole story of public health in Chile. And this is very interesting. And I'm certain that in other countries of the Americas, also members that have participated in the dialogue and the approval of this code certainly had a significant impact in the development of these services as well. So thank you very much for sharing your thoughts.
Dr. Kyla Lasserson. She is the Director of Global Health Center of the Centers for Disease Control and Prevention of the U.S. that has accepted our invitation to provide her comments about health surveillance and the Pan American Sanitary Code, a century of collaboration towards global health security. Dr. Lasserson, please.
Great, thank you. Thank you so much. And thank you so much for the invitation. I apologize, I'm in a conference. I'm in the American Society for Tropical Medicine and Hygiene conference, where I'm sure many PAHO colleagues are also attending. I wanted to talk a little bit, as asked, around surveillance. Even 100 years ago, with the code being initiated, the idea of surveillance and the idea of finding all the problems that there are and stopping them at their source was an idea from the very beginning. But even then, as we know today, you can't stop or control or prevent what you can't count or see or measure. And so today, the work of surveillance is the same as it was always, but we've gotten better. We've gotten more sophisticated. We've brought in new innovations, and we've thought more about it over these 100 years. So I wanted to talk a little bit about that. We are now in the process of thinking about global health security and global health surveillance in the context of the international health regulations, in the context of the global health security strategy, in the context of the U.S. National Biodefense Strategy. Surveillance is really one of the key components of any of those strategies. And at CDC, we've created a global health framework in the ways in which we work overseas, and particularly in the PAHO region, where surveillance is our first and most important core capability. So we're working with governments across the globe, and especially in the PAHO region, on building surveillance, on building data systems, on ensuring we have the right tools, the right laboratory tools, but also the right data tools to have the good surveillance so that we can leverage whatever we're working on, whether it's HIV or influenza or antimicrobial resistance, and leverage those pathogen work or disease initiatives towards core capabilities, and particularly surveillance. And once we have that core capability, we can pivot and be ready for whatever we are going to find, known or unknown. At this point, we don't know. But as we think about surveillance, we think about the data and the people behind surveillance. We also think about the partnerships. And the partnership with PAHO has really been longstanding. And we are really kind of very similar institutions and really have worked well together for years and years. And so I'm very excited to be here today to be able to share that. We work with the 17 PAHO and WHO collaborating centers specifically, and we sit together on the technical working groups, on the expert panels, on the technical panels. We help form guidelines together, all around sort of national partnership. And that's been a really wonderful partnership over the years. And then in the last few years, we've really expanded our presence in the PAHO region. So in 2020, we established the South American Regional Office in Brazil. And just last year, we established the Caribbean and Central American Regional Office in Panama. And then in addition, we have presence, sometimes a bigger presence, sometimes a smaller presence, in 10 additional countries in the region, working on everything from HIV, TB, and PEPFAR, to AMR, to respiratory disease, to vector-borne disease, and to immunization. And as we're doing all those different sort of disease or pathogen initiatives, we are continuing to build surveillance systems and data systems together with partner governments and with our partners with PAHO to really strengthen that core capability. And then we can kind of work together on our shared priorities. For example, the Disease Elimination Initiative to end more than 30 diseases. So working together with those core capabilities, and strengthening those so that we can work on that disease elimination initiative, working on NCDs, maternal mortality, vector-borne diseases, vaccine preventable diseases, in the kind of a One Health framework, migration health, which is such an important aspect of this region. And over the years, we have really worked on many of these things. We've had many successes, and I just wanted to highlight a few. I wanted to speak specifically about Oropouche and dengue, which of course has been a very important issue in the last year, really, and especially in the last few months with Oropouche. And I wanted to just to express my gratitude to PAHO and the collaboration we've had on Oropouche, where we've really had a lot of early information sharing. I think we know that we don't know a lot about Oropouche. We have a lot of questions still about clinical manifestations, vertical transmission, vector epidemiology, and sort of vector biology. And we've been working really closely together with you on that. And I really want to appreciate that, because that's actually the kind of way we can work together and bring in different strands of knowledge, different strands of expertise to really work on that kind of problem. So that's only one. We've also been working on antimicrobial resistance together. We've worked on the first cases of bird flu, which happened in Ecuador last year. And then I wanted to highlight polio, because 2024 marks 30 years of the region being wild polio virus free. And that's been also a very strong collaboration between PAHO and CDC in the realm of immunization. And immunization is also building that core capability, of course, of surveillance. So looking to the future and thinking about all the ways in which we're collaborating, we have more regional work together on AMR. We have event-based surveillance that we're working on using epidemic intelligence from open sources. We're even working together on the guidelines for viral hemorrhagic fever detection and response, monitoring all the vaccine preventable diseases, and really kind of working on the big catch-up, which is, put us behind after COVID, the immunization levels, and working together on getting those levels back up. Of course, on serosurveillance and innovative tools for using bead assays for multi-pathogen surveillance. So all of this is really for global health security, and surveillance is really our first key core capability to continue to have that sort of surveillance and to work on that together, to build up the immunization systems and to have the right emergency response, all of it kind of stemming from surveillance for global health security. So I really do want to thank you for this opportunity, and know that, global health security is national security wherever we are. And so we have to work together. We've been working together so well over these many, many decades, and we look forward to many more years together. So thank you very much for this opportunity.
Thank you. Thank you, Dr. Larson. It's really great to hear the importance of strengthening surveillance, particularly, as you said, to stop any outbreak at the source. And as you well know, it's for the benefit of the people and the countries themselves, but also how this surveillance across the region is also important for disease elimination and several other topics that are related, and how this topic of surveillance is also being discussed at the Pandemic Accord after the amendments to the IHR. Thank you, Dr. Larson. Ahora tengo el placer de invitar a la doctora Vivian
So
Curie.
now I would like to invite the director of the Curie Institute of Cuba, Dr. Vivian Curie Cardela. So we go from the city that established the American Health Organization to the city of the Havana, Cuba, where we approved the Sanitary Code 100 years ago. So Dr. Vivian Curie will talk to us about the scientific investigation and innovation for prevention, the control, and the elimination of these infectious diseases. Dr. Curie, you have the floor. Well, good afternoon. Thank you very much, everyone. I would like to start by thanking PAHO for inviting me to participate in this panel that has been organized to celebrate 100 years of the Pan American Sanitary Code that was signed in Cuba. So the communicable diseases at the time were a barrier for the sanitary code, and they continue to be a threat today. Despite the progress that we have seen in molecular biology with modern medicine, we have also modern challenges for the elimination and the control of the diseases. No country is free from these hazards. We have tuberculosis, malaria, HIV, AIDS. These are very serious diseases, and these affect our public health, international public health scenario. And we have also populations that are the poor populations that are severely affected. So the pandemics have also have been a landmark in these last centuries. We have seen a devastating dissemination of these viruses, and we have needed research to respond to these health emergencies. COVID-19 was sorry, we're having some internet. We cannot hear the speaker. So in November of 2024, the Americas have reported an increase of dengue of 209% compared to 2023. So approaching the challenges that these chemical diseases present will require disciplinary efforts. We will need to work together with science and innovation, where we can join the willpower of the government and international agencies, the public and the private sectors, the universities, the pharmaceutical companies, and the health institutions to promote a common good. I would like to take some minutes here to talk about my country. Many have asked, how is it possible that Cuba, a small island that has suffered and continues to suffer the longest and most severe sanctions in modern history, and how have we achieved a significant improvement in medicine and biology, and microbiology? How have we faced these challenges? Cuba has a robust science and technological innovation system in health that integrates science, technology, and the public health policies. We have aligned our scientific developments to health issues to respond to the needs of the population. I would now like to talk about some key components about the Cuban people and how we face infectious diseases. The national health system in Cuba is free, universal, and with a high sense of solidarity, managed by the Ministry of Health. It's integrated by a network of sanitary institutions, which are a strength for us, based on primary health care and organized in 3 different attention levels: primary, secondary, and tertiary. Besides this, we have the universities that are in charge of human resources. And with the investigation, the research centers, we develop this sector. For the surveillance and control of infectious diseases, we have in the ministry a specific area focused on epidemiology that is organized with national health programs that is supported by a national network of labs in the whole country that is also stratified in 3 levels. And this ensures the surveillance of pathogens and also early response to the threats of infectious diseases, always counting on the follow-up of PAHO. So similar to other countries, Cuba has faced several outbreaks and epidemics, but the success in this struggle is due to the preparation of our personnel and the organization of our health system. It's also important to highlight the research and the contribution of Cuba in this field. So we have epidemiological clinical studies about pathogenesis, genomic surveillance, the propagation of vectors, and also environmental studies. We can also say proudly that Cuba has one of the immunization programs that is most successful worldwide, with more than 95% of our children vaccinated, and the application of 17 vaccines. 10 are produced nationally that prevent 14 diseases. During COVID-19, Cuba has developed the 2 vaccines, Soberana and Amdala. And with our vaccination campaign, in 16 months, we were able to protect 92% of the population. So the biotechnological sector in Cuba is also a foundational stone of our health innovation strategy. So we have several research centers that develop bio drugs and scientific advance. So Cuba has been crucial to prevent these communicable diseases through our surveillance programs and our vaccination programs and technology progress, and also community health initiatives. We have been able to control these infectious diseases successfully. Before we close, we'd like to call on all countries to improve equitable access to medication, resources, and technologies, and also to promote and to foster research and innovation regarding communicable diseases. And we want these efforts to be implemented globally, regionally, and locally. Thank you very much for this opportunity. Thank you very much, Dr. Khoury. So it's very important to see how technological progress of a collaborating center of PAHO and WHO. It's great to see what you're doing in Cuba, a country that where the health system is a benchmark for many other countries in the world, and how important it is to develop our teams and also to emphasize the access to technologies. And this is one of the priorities also that Dr. Barbosa has implemented in the region. And this is a collaborative effort between our countries. So thank you very much. And now we would like to go on to excellent Dr. Alicia Trinidad, which is the Minister of Health of Brazil, Dr. Alicia Trindade. And she's going to talk about how we're advancing collaboration to prevent and control health emergencies in the region of the Americas. Go ahead.
O Código Sanitário Pan-Americano, assinado em
The Pan
1924,
American Sanitary Code from 1924 represented a moment for international cooperation that crossed borders for all populations in the Americas. PAHO had been created in 1902, and it represented a big step, or gave a big step with the approval of this code for Brazil. This important milestone of public health helped in the advancement of surveillance, epidemiology services, and sanitary security, which made Brazil a reference to the world. We know that we still have a lot of challenges to face. The experience in the Americas was essential for the International Sanitary Code, which was approved by the UN in 1969, and then it was reviewed in 2005, and in the last General Assembly of the WHO in 2024. With this, we strive to improve the health of the societies and advances in surveillance, epidemiology, and other public health actions. The Americas were essential in this process, and here I'd like to congratulate the director of the Pan American Health Organization, Dr. Barbosa, and the representative of PAHO in Brazil, Dr. Socorro Gross. And I wish this celebration is one more milestone to intensify, to strengthen the collaboration between the people of the Americas who will and have benefited through this collaboration. Thank you very much.
Bueno, muchísimas gracias, señora ministra.
Well, thank you very much, Mrs. Minister, and please receive our embrace from all of us in Brazil. And it's great to see how cooperation and progress that we have seen in Brazil in the response of health emergencies is an area of collaboration between countries. And also, soon we will be working together in the region to discuss about the action plan, the epidemiologic intelligence to control epidemics and health emergencies. So thank you very much, Doctor. And now I have the pleasure of inviting Mr. Juan Carlos Salazar, which is the Secretary General of the International Civil Aviation Organization, that will talk about the aviation codes throughout time. So tracing their roots and evolution, including the Pan American Sanitary Code. You have the floor.
Distinguished colleagues, honorable guests, ladies and gentlemen, I am honored to participate in this celebration of the Sanitary Pan American Code 100 Years of Health Collaboration. A century ago, as aircraft were just beginning to transform our world, visionary leaders gathered to sign the Pan American Sanitary Code. They made a remarkable decision to include aviation in their groundbreaking health regulations. In an era when international travel meant long ocean trips and most health measures focused on seaports, these pioneers looked to the skies and saw the future. That inclusion of buques aéreos, or aircraft, in Article 61 of the Code, came at a time when commercial aviation was still in its infancy. Yet, those early architects of international health cooperation already understood what we know now with certainty, that the future of public health will be inextricably linked with air travel. Coming just 5 years after the Paris Convention of 1919, which established the first international rules for air navigation, the Pan American Sanitary Code built upon decades of international health initiatives. The later Convention on International Civil Aviation will similarly recognize the crucial link between aviation and public health through 3 articles addressing disease prevention and travel facilitation. These articles establish 3 fundamental principles: preventing the spread of disease, streamlining aircraft entry procedures, and facilitating efficient border processes. This early framework recognized that protecting public health must be balanced with maintaining efficient air transport operations. Today, the principles established in the health and aviation codes remain fundamental to our work at the International Civil Aviation Organization. These principles, international cooperation, standardization measures, and the balance between protecting public health and facilitating commerce, are anchored in Article 14 of the Chicago Convention. This article requires states to take effective measures to prevent the spread of communicable disease through air navigation. It also mandates close coordination with agencies responsible for international health regulations, particularly with the World Health Organization, to mitigate the impact on public health events on aviation. These principles are embedded through ICAO's standards and recommended practices, appearing in 8 of our convention annex, with particular emphasis on Annex 9 on facilitation. Our framework is strengthened by detailed procedures for air navigation, comprehensive guidance material, and specialized programs. Among these is the ICAO Collaborative Arrangement for Prevention and Management of Public Health Events in Aviation, which is better known as CAPSCA. The COVID-19 pandemic powerfully reminded us of the essential intersection between aviation and public health. During this unprecedented crisis, we witnessed how rapidly changing health requirements could severely impact aviation through flight bans and passenger restrictions. ICAO's Council Aviation Recovery Task Force led our global response, providing guidance and implementation packages that reflected our no country left behind principle. This experience led us to strengthen our partnership with the World Health Organization in 2022 through a formal Memorandum of Understanding and establishing an annual updated working plan at both global and regional levels. As we mark this centennial of the Pan American Sanitary Code, we honor those visionary leaders who first recognized aviation's crucial role in public health. Their legacy lives on as ICAO works closely with the Pan American Health Organization, the World Health Organization, and our United Nations partners to address today's challenges. From emerging diseases to climate change, we continue their spirit of international cooperation and visionary thinking, ensuring aviation connects our world safely, securely, and efficiently. I thank you very much.
Thank you very much, Mr. Juan Carlos Salazar, Secretary General of the International Civil Aviation Organization. You highlighted a couple of points who are mostly important related to the trade, but also well-being. How the impact of this code had when the aviation was still being at the early days, and how this international travel is also at the core of the Pan American Sanitary Code when it was approved, when probably we didn't have a Spanish translation of aircrafts. Buques aéreos is the wording that they used at that time, just to highlight how important it was and how important it is nowadays. Thank you so much for your words. Now I'm pleased to present Dr. Peter Figueroa, Professor of Public Health, Epidemiology, HIV and AIDS at the University of West Indies in Jamaica. Dr. Figueroa will present us a century of immunization under the Pan American Sanitary Code, the triumphs, the setbacks, and the road ahead. Dr. Figueroa, please.
Thank you so much, Ciro, and thanks to PAHO and Dr. Jabas for the invitation to speak on this important topic. Of course, the triumph to me is the EPI program itself. The immunization program is the flagship program of PAHO and the Americas, and it has saved millions of lives. It has transformed life expectancy and quality of life for the people of the Americas. Vaccines are the most cost-effective immunization, the most cost-effective intervention in health. And the success of the EPI program, ironically, has made it more difficult for people to appreciate the value of vaccines, because when I was growing up, many children were dying of measles or were crippled by polio. But no, that is not the case due to the success of the EPI program. And of course, there's much more misinformation and lack of understanding of new technology. And this undermines the confidence in vaccines. In the early part of the 20th century, of course, smallpox was a huge problem, and there was an intensified smallpox eradication program globally initiated in 1967. The Americas eradicated smallpox in 1974, and globally, the World Health Assembly declared it eradicated in 1980. This is one of the most outstanding public health achievements of the Americas and globally. In 1974, the WHO established an expanded program of immunization, which was launched also officially in the Americas in 1977. There were 6 vaccine-preventable diseases initially, and coverage through this program improved from 50% in the 1970s to over 80% in 1992. And Americas was the first region in the world to eliminate polio in 1994. Americas was actually free of measles in 2002, but there was a significant setback with the reintroduction of measles into the Americas, because measles is one of the most infectious diseases, and you have to have very high coverage with the measles vaccine to prevent it. But the Americas did achieve certification of elimination of both rubella and congenital rubella syndrome in 2015 and of measles in 2016. The English-speaking Caribbean is very proud of the fact that with the support of PAHO, we actually eliminated the last indigenous cases of these diseases before the rest of the Americas. We achieved polio elimination in 1982 compared with 1991 in the Americas. And for measles, we achieved the last indigenous case in 1991. So these were great achievements throughout the Americas as well as the Caribbean. Now, The PAHO Technical Advisory Group played an important role in supporting the PAHO team led by Cira de Quadras. It was formed in 1980 to provide technical advice to the EPI program. It was formed by leading experts in the Americas and chaired by Dr. D.A. Henderson. Cira de Quadras, who was the leader of the EPI team at PAHO, was secretary to the TAG. Aside from its private meetings, the TAG met every 2 years with the EPI managers from all the countries, as well as the surveillance and lab staff and others. Technical decisions were made in a transparent way based on the science and experience of country programs. And EPI managers were able to hear the discussions and the thinking of the experts on the TAG. They heard them firsthand and could participate in the discussions. And this motivated EPI managers and their national teams. If we explore the success factors for EPI in the Americas, I think we have to say that the national governments of all the countries showed their commitment and put resources into their EPI programs. We must recognize the outstanding leadership of Cira de Quadras, who led the PAHO EPI team for over 2 decades and provided tremendous support to the countries. The TAG, of course, provided strong technical guidance. The establishment of the EPI revolving fund for vaccines by PAHO in the late 1970s was very important. The sub-regional annual EPI managers and the development of their annual plans. Initiatives like the Vaccine Week in the Americas was important for the success. And in those days, people understood the value of vaccination. So we must understand and see EPI as a public health and social movement in the Americas with shared vision, solidarity, and accountability. There are clearly EPI challenges that the countries, and with the support of PAHO, has to address. Many countries have significant migration and active recruitment of their technical staff. We have to find ways of retaining more of our staff within the countries, and of course we have to continue to train and build new staff, build the capacity of the programs. We must effect digital transformation of our EPI programs throughout the Americas. Some countries already have electronic registers and surveillance systems, but other countries need to establish electronic systems. Of course, we must strengthen our country programs, and it's important to have strong legislation in place to underpin and protect the funding for EPI and ensure that the EPI program is sustainable. The role of the NITAGs and the regional network is important, and we must do better to promote the value of vaccines and vaccine confidence among people. And this requires us to improve our communication with the people and empower them. Our partnerships, numerous partnerships, are very important, and always there is a key role in addressing these challenges for the EPI PAHO team and the revolving fund. But we have an important social movement for vaccination in the Americas that we must cherish. Now, new developments, the director of PAHO has made an important initiative, Dr. Barbosa, where he's established a new strategic advisory group, a SAG, on immunization. Of course, there are many new vaccines in the pipeline, and countries are going to have to integrate these into their programs. I have a couple old concerns that I see the importance based on my experience of working with Cira. So I put it in tribute to Cira. Countries need to ensure stronger, sustainable routine immunization infrastructure and programs. And the COVID pandemic showed us that we have to build infrastructure to vaccinate adolescents and adults. At the global level, we need a major systematic, strategic, well-funded initiative to support the 10 low middle-income countries with the most zero-dose and under-vaccinated children to help them to expand their essential EPI infrastructure. However, the bottom line is that we must sustain the historic gains of EPI in Americas. I thank you.
Thank you, Dr. Figueroa. Your words hit home, because that's very clear for us that the expanded immunization program that was just created in the Americas in 1977 continues to be the flagship program for the Americas. And yes, there are some setbacks in the last few years because of the COVID-19 pandemic, but also there are some challenges on retaining staff and how to progress in several aspects to reduce the reemergence of some of the diseases, including, as you mentioned, measles. Fortunately, the countries that did have measles transmission in the countries are advancing to their elimination. We just heard good news from Brazil lately, so that's excellent. Thank you, Dr. Figueroa. And now, with that, without further ado, I would like to ask our director, Dr. Jarbas Barbosa da Silva, to please provide his closing remarks. Dr. Jarbas, please.
Thank you, Ciro. I think that I also want to thank the more than 300 people that connected and participated in this very, very important webinar. First, I want to thank the participants of this panel, Professor Figueroa, that remind us how important it is to keep the leadership of the Americas in the global scenario. The Americas was the first region to be certified 30 years ago as free of polio, wild polio, and now we are regaining the free of measles condition because Brazil was recertified a couple of days ago. Also, I want to thank Mr. Salazar that called our attention how modern was the code 100 years ago that was already thinking about how to adopt measures to prevent the spread of diseases related to aviation that was at that moment starting as a commercial enterprise in the region. I also want to thank the ministers, Minister Nida Trindade from Brazil, Minister Jimena Aguilera from Chile, that shared with us some historical, very historical dimensions, perspectives from these two countries. I also want to thank Dr. Curi Cardella from Cuba, the country that was the venue of the approval of the Pan American Sanitary Code, and also Dr. Lasserson from the US CDC, a very important partner for PAHO, working together to strengthen the surveillance and response capacity in the Americas. I think that it's important to first recognize that the same concerns, the same public health issues that our predecessors faced 100 years ago still remain as a very important challenge. So I think that it's very important that the countries have already achieved the amendments that strengthen the international health regulation, but to call our attention that the task is not finalized yet. We need to discuss, we need to build consensus to approve the new pandemic instrument in order to have the world better prepared. If we don't address some dramatic things that happened during the pandemic, the COVID-19 pandemic, like the inequitable access to PPEs, to medicines, to respirators and vaccines, we will not be better prepared for the next pandemic. So I think that the spirit of the Pan American Sanitary Code needs to preside us during this discussion. I think that the Americans have a very important role because you have both in our region countries that are leaders of the developed countries and the South, global South countries. So I think that when the Americans come together and reach consensus, it facilitates the whole world to come to a consensus. So I really want to thank you all to participate in this very important event for us. It's not only to celebrate, but also to reaffirm our commitment to work together to strengthen the Pan Americanism and a better coordination among our countries to be better prepared to identify, to respond, and to face all the public health challenges that you have ahead. Thank you very much.
Recording stopped.